Isn't just about small babies, it's about survival strategy. Every restricted fetus is fighting a silent battle for oxygen and growth inside the womb. In this video, we will uncover what's really happening behind those Doppler waveforms, how the placenta, the fetus, and the circulation adapt under stress long before things go wrong. You'll learn how to spot the warning signs early, make confident decisions, and protect your tiny patients before it's too late. Because in fetal medicine, timing isn't everything, it's the difference between recovery and loss. 6. Intrauterine growth restriction, or IUGR, describes a fetus that isn't reaching its expected growth potential. In other words, the baby is growing, but not as much as it should for its gestational age. For practical purposes and to identify pregnancies that might be at risk, we usually define IUGR as a fetal weight below the 10th percentile for gestational age. This isn't perfect, and not every small baby is pathologically small, but it gives us a starting point for careful monitoring. Now, a term you will also hear is small for gestational age, or SGA. This describes fetuses that are constitutionally small, petit by nature, but otherwise healthy and developing normally. Always remember, all IUGR fetuses are small, but not all small fetuses are IUGR. The key difference lies in the size, not in the size alone, but in placental function and fetal well-being. Defining IUGR isn't as simple as picking a single number. Several criteria exist to help identify fetuses at risk of pathological growth restriction. The most commonly used definition is an estimated fetal weight below the 10th percentile for gestational age. This serves as the standard screening threshold in most clinical settings. There are also alternative cutoffs depending on clinical context. Estimated fetal weight below the 3rd or 5th percentile. This is more specific for true growth restriction. Estimated fetal weight below the 15th percentile. This is sometimes used for broader population screening. Estimated fetal weight less than the 2 standard deviations below the mean, statistically equivalent to the 3rd percentile. Always interpret these cutoffs in context with trends, Doppler studies, and clinical findings. Percentiles are just the starting point. The full picture is what guides management.